I work in public health, and I have a remit around workforce development, public health workforce development, really. That's my role currently. We've been using it really to industrialise behaviour change across all our sectors, I guess. So it was good because it was a hook that catches people's imagination, I think. Obviously, it relates to the staying healthy agenda of the region, so we wanted to respond to that. But I think that having a sort of, even the snappy name makes a difference, because everybody knows that. And even though our strategies in different sectors have their own names, so there's Leeds Let's Change, which is in health, there's Health is Everyone's Business, which is in the council, but it all started around the Making Every Contact Count sort of agenda. And we've used the framework to look at the skills and competencies that are needed. So that's gone into some people's PDPs. We've looked in the council, we're working with HR, so it's gone into their organisational development plan. And we're looking at strategic champions, peer supporters, and people to work on spreading the message around making every contact count. So their agenda is called Health is Everyone's Business, but it's based on the Making Every Contact Count.
That's good.
Sort of
You've alluded in that to say that this is like cross-organisational. There's more than one organisation, and has that been useful to be talking across organisations?
Well, to start with, we thought that we needed to work with primary care. So it started off, the Leeds Let's Change agenda was mainly aimed at primary care and Leeds Community Healthcare Trust. So we've looked at the SLAs and made sure that Making Every Contact Count is explicitly written into the SLAs, and the skills and competencies from the framework need to be represented there, and that the delivery of Making Every Contact Count, from brief advice through to brief interventions or the longer interventions, are written into people's contracts appropriate to role. Then we went into LTHT, which is the Acute Hospital Trust. We start in cardiology, but it's been a little bit slow there. So there's work going on, but it's been a little bit slow there. LPFT, which is our mental health trust, heard about it and said they would like to be involved. They have a health and wellbeing team.
Right.
So we're working with the health and wellbeing team around Making Every Contact Count. Then with the council, I work as part of my role with the council, because they're going to be taking on the public health remit. Of course. Certainly, from a wide determinants point of view. So but with the public health workforce development role, so I've been working with the council. So because I was working with Making Every Contact Count, it made sense to just take it in there, really. So, as I said, we're working with human resources, so it's going into their organisational development, it's going into their PDPs, and we've looked at using some of the competencies from the different levels. So I've picked them out, using it like the Skills for Health type approach. So if you're a senior champion, which is really our counsellors, there's a responsibility for understanding. Obviously, they're not going to be doing brief interventions or giving brief advice. Well, they might do, I suppose. But
they might evolve to that, might.
But that's not what we want them to know. Is to understand. So actually, they've got some of the competencies written in at level 3. Actually,
that's good.
But as I said, I'm picking and choosing depending, and we're also working, or they're working with the cleaners. That's their latest group, because they employ an awful lot of cleaners. I think it's over 1,000 probably across the city, and they come from our target areas. So if we can work with them around the messages, passing the messages on, if we can have some of them as peer supporters, and they seem to be wanting to volunteer for that, hopefully we think we'll get those messages into the communities.
That's a really nice example. Thank you for that. got ahead of the question that I was going to ask you about that. So it's a really good example of that. Do you think with making every contact count, and also the framework that underpins it, it's wider than just health and social care in the sense that it is a community-based thing?
Well, that's the way we've used it anyway. I know most of the things you read about it are very health orientated, actually, even more than social care, although I know that you've trialled it with social care. But yeah, I think if it is everybody's business, then we need to go broader. And obviously people are very good at signposting, if they believe in the message.
Yes.
But obviously we don't want people doing it inappropriately,
No.
which is why we need to have the training. So another thing that we've done is commissioned a lot of training. We've got 7 different half-day sessions. The most basic one at level 1 is the every contact count one, and we've had people that have come into that who've been sent on it.
Right. Okay.
Who've said,
I remember that.
who've said, I don't know why I'm here.
Yeah.
It's not my remit, and particularly from the council, people that have come onto that, they said, what am I doing here?
Yeah.
But by the time they've gone out, they've said, I completely get it. So that's really good, and that's with Damien Edwards, who's doing that training, and he's a clinical. I'm not sure whether he's a clinical psychologist, but he's definitely an advisor around CBT and those sorts of things, to the obesity forum.
Yes.
He speaks all over the country, and he's a very motivational
So
trainer.
he's got the right skill set, but he also understands
skill
the levels of people.
Yes, and he's inspirational to listen to. So that's our basic training, but then there are 6 others that are at level 2 and level 3.
Right.
Where he's using the skills that people can actually learn that morning, and they have to go and practice them, but they can take them away and practice them, but they're based on some of the psychological theories and skills across the board, from CBT to NLP, motivational interviewing, those sorts of things, motivational conversations, he would say, rather than motivational interviewing, which, as we know, is a whole practice in itself.
Absolutely. Yeah.
So, but using some of those techniques, and people seem to be very appreciative. So we've only just started that programme, and obviously we'll be evaluating
Yes,
it.
of course. No, I mean, it sounds really good. I mean, one of the things we talk about when we're relating to making every contact count is that if we're going to have an impact, it is at that lower level, level 1. I guess because there's more people in that, and that's not about hierarchy, because that could be somebody that's quite high up in the organisation, but they're only going to have those brief interventions. Is that? Can you give me any other examples or any other plans you've got that are around trying to spread that as wide as you can in relation
to
level
that? 1.
Yeah, level 1, yeah.
At level 1, to be honest, most of that is aimed at the work with the council.
Fine. Good.
Because to be honest, at level 2 and level 2, we're working with nurses that do the health check, for example, because we're rolling out the health check, so we've piggybacked it onto the health check.
That's useful
as
to
well.
know, thank you.
So that's a one intervention situation.
Yes.
But actually they've got people in front of them for 20 minutes.
Absolutely.
So level 2 is probably better. We introduced level 1 to them. So if that's all they want to do, if they just want to raise, they have to raise it anyway, because it's a health check.
Yes.
And signpost people, then that's absolutely fine. Yeah. But if they want to have a bit of an intervention and motivate people rather than nag people and put them off, and tell people a little about the services that we offer and how that can benefit them and how they're more likely to succeed if they take up these opportunities, then I think it's worth training them up. And I think that making every contact count, the words sound to me anyway that every contact we have around behaviour change has to make a difference, has to count, whether it's at level 1 or whether it's at level 3.
And also values the people that are doing it, doesn't it, as well?
It does.
Because quite often they don't get that sort of, we think you can do this approach.
No, that's right, which is why we wanted this training. So we've got training looking at giving messages to men as opposed to women. There's all sorts of ways we're looking at training these people up so that their communication skills to promote behaviour change in their clients is improved greatly. So that's what we're hoping for, and we are auditing the changes. So all the services will be feeding back where they're getting referrals from. So we'll actually be able to see a change.
Yes.
So we're looking at if there's a continuous change from when the programme's implemented. After 3 months, if it's continually, then I think we can really say it's not just a blip, or not a blip, just not just a.
It's beginning to have an impact.
Yeah, that it's getting embedded. So we've had to put in place a whole system around this anyway.
Yes.
So we've got referral pathways.
Yeah.
We've got a single telephone number for people to contact, and we obviously had to negotiate with the providers that they would capture the information, and we've had to work with them and around their IT systems so that they can capture it as we need it. So we know where people are being referred from. So we know that if they've gone onto our course, if they're signed up to Leeds Let's Change, then they need to go on the training, the Making Every Contact training, and they need to sign up to the whole pathway so that we can capture whether it's making a difference.
Yes, of course. That's really a strong approach around an all systems approach, which is really interesting. So thank you for that, and you've preempted a lot of the questions I was going to ask you in your dialogue, so that's great. One final one, what's the aspiration for you and also for this? Sort of where would you like to see it in 18 months' time, for argument's sake?
Well, I'd like to see obviously a lot more referrals into our services. It would be good to see a lot more people taking control of their own health as well. I guess another sort of angle on this is, which I'm not quite sure is absolutely making every contact count, but as far as the competency framework's concerned, it is, because what we've done is that we've looked at people who are working where they won't be able to have those one-to-one frontline contacts, but where they can influence the wider determinants.
Yeah.
So we're trying to get into their psyche that that health is their business as well. So actually we've looked at competencies from the competency framework where they're not actually doing the brief advice, but in their work programs they are addressing the agenda. So that's, again, I've pulled out some things around behaviour change and adapted it, well, not adapted it, but lifted it and put it in for that purpose as well. So
it's okay to adapt from my point of view as well, because well, you have to make it fit for your purpose, don't you?
Yeah.
So that's good. That's good.
But it would be great if we just have a whole culture change really across the city. Okay. We have a conference, a health and wellbeing conference, would be our 4th annual conference.
Right.
But it's around all the change agenda and enabling people to make the changes. So we're hoping that people will come right across sectors, that they'll learn about the Making Every Contact Count, the Leeds Let's Change, the health of everyone's business, and how everybody has a part to play. That's what the message is. And about the training that's on offer. We've got Mike Kelly talking as well, so he's going to be talking about Making Every Contact Count at the conference. And we've got Damien Edwards, who's our trainer, talking.
Good.
So it would be great if we actually managed to have a whole culture change across the city.
That would be great. Thanks very much for your time.
You're welcome.
Cheers.